A new study has found that frequent fish consumption is associated with lower disease activity in patients with rheumatoid arthritis. In the study conducted from Brigham and Women's Hospital and Harvard Medical School, researchers examined data from 176 patients from the ESCAPE-RA cohort study. They found that individuals with rheumatoid arthritis who consumed fish 2 times a week or more had lower disease activity, such as swollen tender joint counts, along with other assessments, in comparison with those who ate fish never to less than once a month. They say this suggests that fish consumption may lower inflammation related to rheumatoid arthritis disease activity. The results are published in the journal Arthritis Care and Research. Rheumatoid arthritis is one of many different types of arthritis and other musculoskeletal conditions which have the common issue of causing pain and physical disability. Joining us live via Skype from Truro, United Kingdom, for more on the subject is Professor Anthony Woolf with the Bone and Joint Research Group Knowledge SPA in Royal Cornwall Hospital, Truro. Professor Woolf, welcome to Africa 54.
Thank you. Hello.
First of all, there was this research about diet on rheumatoid arthritis. Could you just give us your take on the impact of diet on rheumatoid arthritis and bone disease?
Well, rheumatoid arthritis is a disease which causes pain and swelling in the joints, and that can also cause joint damage, and that's what leads to the long-term disability. And the inflammation which causes the pain and swelling is due to various chemicals, and fish oils can affect those chemicals and reduce the pain and swelling. Unfortunately, they don't necessarily prevent the damage, and that's why any diet with increased amount of fish needs to be combined with other treatments to suppress the damaging parts of the arthritis. But it's a very interesting, good story, because people always want to know how they can help themselves.
Yes. Yes, and when we look at arthritis in general, there seems to be a misunderstanding about this condition. A lot of people tend to think that it happens to the elderly, but this is far from the truth.
Absolutely. Rheumatoid arthritis, unfortunately, commonly starts in the 30s, people age 30 and onwards, and is a lifetime condition, and its impact becomes greatest when people get older. But it is something which affects younger people, and this is what gets forgotten. But the great thing is, over the last couple of decades, treatment has really advanced enormously, and now if we see it early and treat it effectively, we can really try and control it and minimize that damage and disability.
Let's talk about bone and joint disease in general and how much of a burden it is to people globally.
Well, as you said earlier, rheumatoid arthritis is just one of the forms of diseases which can affect joints. The more common type is osteoarthritis, which is often thought of as wear and tear. But also there's back pain, neck pain, and lots of other conditions which cause pain in your limbs or your neck and back and affect what you can physically do. And they're now found to be the greatest cause of disability worldwide, particularly back and neck pain. And that applies in countries like, continents like Africa as well, particularly if you look at those who've survived childhood conditions and infectious diseases, and the people who are getting older, this is really a growing problem. It is not being addressed adequately.
Professor Woolf, before we finish quickly, what are some of the ways that people can prevent this to happen?
Well, the main thing is to keep active and mobile, even if it hurts a bit. Avoid being overweight and have a good, balanced, healthy diet, which means adequate calcium, adequate vitamin D, and fish oil, which can help for the aches and pains, can also give you the vitamin D. And then if you do get a problem that causes you a limitation of what you're able to do, you should seek appropriate care, because now a lot can be done, and we don't need to have such a negative attitude that it's just aging and you should put up and shut up.
Okay, Professor Woolf, thank you so much for joining us from the United Kingdom.
Thanks for the opportunity.
And that was Professor Anthony Woolf. He is with the Bone and Joint Research Group Knowledge SPA in Royal Cornwall Hospital, Truro, United Kingdom.